Thank you. My name is Catherine Metayer, and I'm pleased to be here to present some of our work. I'm the director of the Center for Integrative Research on Childhood Leukemia and the Environment. So what do we know about childhood leukemia? Leukemia is the most common cancer in children. About 38 children are diagnosed every year in the United States. We know that the treatment has improved over the last decades with chemotherapy and radiotherapy. However, leukemia and other cancers in children still remain the second cause of death. What we know also is that those children who are surviving are facing serious complications, physical and psychological complications throughout their lives. So what we really want to achieve here is to understand why do they have the disease at the first place and how can we prevent it. This is even more important because the rate of childhood leukemia is increasing. It has been increasing by about 1% over the last 40 years. So what is going on? To put these numbers in perspective, this is a figure that tells you how many more children are being hospitalized and treated for childhood leukemia since the late 80s. And you can see that the numbers of children is increasing dramatically. And what we find out is that Latino children are more affected by childhood leukemia than other children. So what is going on? And this is true for the United States, but it's true also for Latin America. What that tells us also is that in a such short period of time, 40 years is really short in terms of human selection and process, is that the environment at large must be the primary contributor of this increase. Yes, there may be some genetic factors that could also influence the increase, but this is not the only one. The environment must explain this increase in a short period of time. What do we know too about childhood leukemia is that most of them, which we call acute lymphoblastic leukemia, ALL, are occurring at a very young age, anywhere from 1 to 5 years old. This is quite impressive. We know that cancer is a disease of aging and that most of cancer patients are adults. So what is going on for children to develop the disease so early? So this is where we are focusing our effort on not only early years of life, but pregnancy, like Brenda mentioned, but also preconception, because we learned that the impact of any insult could actually start before conception. So this is a very important clue for us to focus on prenatal exposures. We have actually demonstrated that some of the mutation that we find in the blood cells of children with leukemia were actually already identified at birth. So we know that the first hit is likely to happen during pregnancy or before. So our research started here in California back in the late 90s, and we expanded from the Bay Area into the entire California state. But childhood leukemia is a rare disease compared to cancer in adults, like breast cancer, prostate cancer, lung cancer. So we are really challenged by the small numbers, and to allow us to do a better job, we established the Childhood Leukemia International Consortium to really bring forces together, and we reached out to other researchers around the world to work with us and form this consortium. And just to give you a sense, our study started back in the late 90s, and we're able to enroll anywhere from 1,500 to 2,000 families. With the consortium, we have 38,000 of children with leukemia with data that we can analyze. That gives you the power of working not only locally but globally. So what do? We want to understand what type of exposures the parents and the children were exposed to early in life, during pregnancy, and before pregnancy. And because epidemiology, we know, is not an exact science, it's not mathematics, so we have to use different means to get closer to the truth. And we use a different approach, a tier approach, to target and understand what type of exposures the family was facing. So we have the traditional approach of interviewing the parents to know what type and when they were exposed to chemicals and their lifestyle. We have information on where they lived, and we can now link this information to publicly available database on air pollution, pesticide use, and the California state is great for that. There's a great resources there in terms of doing those type of linkage. What our study really was novel about was to try to go beyond the interview and understand better what are the families exposed to. So we went back to their homes and we collected dust. And why dust? Dust is an amazing reservoir of persistent chemical, and maybe you don't want to know what's in your dust, but we went to the effort to collect dust and analyze this for about 50 or 60 different chemicals. And this is really novel approach compared to other groups around the world. What we want to understand too is what is the body burden of those chemicals. So we collect a different biospecimen to have a better understanding of that. So what have we learned? Well, about 20, 30 years ago, there was only few established risk factors of childhood leukemia. Genetic syndromes like Down syndromes and exposure to X-ray during pregnancy. Likely, the regulation has reduced this exposure. However, we're now looking into exposure to CT scan after birth because those have high level of radiation. But we knew about less than 10% of what could explain the disease. We and colleagues from the consortium have identified since then many chemicals and mixtures of chemicals in terms of pollution, air pollution, smoking, pesticide, solvent, flame retardant, being exposed at work, being exposed at home, that would increase the risk of childhood leukemia. And to some extent, high level of exposure to electromagnetic field has been found to increase the risk of leukemia. That represents about maybe a third of what we could explain about those risk factors. What we've learned too is that some factors are reducing the risk, like healthy diet during pregnancy, folate supplementation during pregnancy that helps to synthesize and maintain your DNA is really important. Leukemia is a cancer of blood cells, is a cancer of the immune system. Therefore, we also established that a well-trained immune system when you are exposed to early common infections is actually good for the child, so we've established that. Most of those chemicals are known to cause leukemia in adults, and therefore it's not a surprise that they are causing leukemia in children. But we still don't know about what caused leukemia for 50% of them. However, for what we know, we started to reach out and establish different prevention programs to reach out to the health clinic, health professional, to the parents. We're definitely targeting Latino communities, and they're most likely to be exposed to the higher levels of chemicals. They must have some genetic sensitivity, so they are a very important community that we are trying to reach out. And we try to be creative, of course, to appeal to different audience. If you are interested in to learn more about our work, please look at the most recent impact report from our funders. There is a lot of work from our centers and from Brenda Center that is presented. Please go on our website, circle.berkeley.edu, and follow us on Twitter, and you'll know more about our work. Thanks.